Yes, I'm happy to take over here this presentation. I am Robin Vermeulen and I'm working at the Radboud University Medical Center in the Netherlands. And I'm indeed focusing on health technology assessments of all kind of medical tools and now specifically on the AI Mind project. And to start with this, often or actually always medical innovations start with a very innovative idea. Here we have the idea of identifying people with MCI earlier and to give an accurate prediction to them of their likelihood to progress to dementia in the future. And like with all other technologies, such an innovative idea goes through a lot of development stages until eventually, hopefully, reaching a moment where this will be implemented. In this case, the AI Mind platform will be implemented for giving predictions to people with mild cognitive impairment on their likelihood to develop dementia. And like with all other innovations and technologies that are used in healthcare, this will probably be associated with some health outcomes, but also some costs. And unfortunately, we're not living in a world where we have unlimited budgets. So also in healthcare, we have to make informed and smart choices when it comes to budgets in order to help as most people as possible. So we have to weigh the added value, the added health outcomes of interventions against the costs. And for this, we can use health technology assessment, in which I will explain in this presentation. So when we apply this to the AI Mind project, for example, if you think about costs for this project, we can think of prognostic tests that we have to perform in order to be able to give a risk prediction. Maybe some treatment at some point that we can give to people at high risk of dementia, but also healthcare personnel that should be involved in the whole diagnostic and prognostic process. Of course, there's more, but just to give you some examples. And if we then go to the potential health effects, for example, a prediction could have an impact on the quality of life of a person. When you have to tell them there's maybe a high or a low risk of progression to dementia, this might have an impact on the perceived quality of life. An health outcome could be the progression from MCI to dementia that might be affected when we are able to earlier detect the people that are at risk of progression and also survival. So how do we then determine if we think that the added health outcomes are worth maybe some extra costs? And in order to determine this, we often depict this in such a figure where we compare the health outcomes of a new intervention to a current strategy, as well as the cost of a new intervention. We compare it also to the cost of the current strategy. And here, if we can say that a new strategy falls in this quadrant of the figure, so where it's both more effective, so it yields better health outcomes, but where it's also less costly, then I think it's no question to us whether we want to implement it or not, because then I think we would all say, yes, let's implement this new intervention. Whereas if it will end up here, if we show from a new technology that it's more costly, but also results in worse health outcomes, then of course we would not like to implement this. But if it ends up here, then it's more questionable what to do with it, especially when it ends up in the upper right quadrant of this figure, where an intervention is more costly, but also yields better health outcomes. And how do we then determine if we want to implement this or not? And here we can use the willingness to pay. That's a threshold that is determined in each country. There's a different threshold. And this actually is a monetary value that we are willing to pay for extra health outcomes. And if we can show from a new technology that the intervention lies here, then we say we have to pay less than our willingness to pay threshold for added health outcomes, so then we want to implement it. Whereas if it's located here, then we say we do not want to implement it. And in order to study this, we can do studies in the field of health technology assessment, which is actually a broad field in which we do systematic evaluations of properties, effects, and impacts of a new healthcare technology. And in this presentation, I will focus on the clinical effectiveness and cost and economic effectiveness of interventions, but actually health technology assessment, or HTA, is a much broader research area where we can also look at technical aspects of a new intervention, legal aspects, ethical aspects, and so forth. So to come back to this figure of all the development phases where an intervention, where it goes through before it reaches final implementation. Traditionally, HTA or health technology assessment is performed in the later phases of the development or the or towards the implementation of a technology, when we have a lot of data from clinical studies, but also a lot of costing data. But a downside of starting in this phase with health technology assessment studies is that there's already a lot of time and money invested in the technology before gaining insight in the added value. And it's often too late to make adjustments in, for example, the specifications of technology and the target population where it works best. So therefore, we should actually start earlier in the development process with health technology assessment studies, so early HTA. And this helps us to gain insight early in the development process about the potential added value of tools. So like I said, indeed in the potential added value, and this can help us to determine how should we further develop such tools. It can also help us to guide specifications. So what should the accuracy, the sensitivity, specificity of a new tool be to really add something to the current practice. It can help us to say something about the positioning. When does it work best? Does it work best as a standalone tool or in combination with other methods? And it can also provide us some insight in what information lacks to define the cost effectiveness. So what other clinical studies should we perform to be able to say something about the potential cost effectiveness of a tool? So in early health technology assessment, we often use model-based evaluations in which we compare a current practice for a patient population, so mild cognitive impairment patients in this situation, to a new strategy, so the AR-Mind strategy here. And we compare, so the current practice, the diagnosis, the maybe treatment of people, and the follow-up. And then we compare it to the new situation where we implement a dementia risk estimation tool in the AR-Mind strategy. And we compare the costs and the health outcomes that are made for each of the, for both of the strategies. So to come back here, this is related to the cost and the health outcomes that I showed earlier. And then we determine what would be the incremental cost and health outcomes for the new intervention compared to the current practice. So the extra costs and the extra health outcomes. And of course, it can also be cost savings, for example. For this study, for the AR-Mind project, we use this model structure, which is a bit simplified, but it gives the general idea. So we simulate a population of MCI subjects, and part of the people we simulate that they go through the current practice, and for part of the population we simulate that they go through the new strategy, the AR-Mind strategy. And in the current practice, we know that some people eventually will develop dementia, whereas others will not. And here we do not have a prediction method to determine who will develop dementia and who not. So we have to wait what happens in future. If we then have a look at the AR-Mind strategy, there the aim is to provide a risk prediction to the people with mild cognitive impairment, whether they will have a low risk or a high risk to develop dementia. And part of these people will develop dementia and part will not. So here we can say that for the people that we were able to predict a low risk, if they do not develop dementia, then we were able to give them a right prediction. Whereas if they do develop dementia, then this was maybe a wrong prediction. And the same accounts for the group where we have to give maybe a high predicted risk on progression. So both strategies are associated with some costs and, for example, with quality of life. So all the states, the dementia states, but also the risk prediction have a certain impact on the quality of life of people. So how do we then determine in early stages when we do not have information from clinical studies for this specific technology, where we have no actual cost data? How do we then determine where in this quadrant might our intervention end up? So that is by running some scenario analysis. So we ask the question, what if something happens? So for example, what if we are able to give a 100% accurate risk prediction? Where in this quadrant will our new intervention end up? So will it then be potentially cost effective? So do we want to implement it or not? And of course, a 100% accurate prediction model might be a big challenge to reach. So then we can also run some scenarios. What if X%, so a certain percentage of the people gets a wrong prediction? So what if we predict for people with a low, with that eventually develop dementia? What if we predict for them that they are at low risk of progression? What does this mean for quality of life, for survival, disease progression? And what does this have for impact on the potential cost effectiveness of our tool? Then we can also run another scenario. So for example, what if there will be a very effective treatment available in the future? And what if we can treat the people that are at high risk according to our risk prediction model with this treatment? What kind of impact does this then have on the potential cost effectiveness of using our tool? And we can also turn it a bit around. So what if we assume a certain accuracy? What can then be the cost for, in this case, the AI Mind platform B in order for it to be implemented under cost-effective circumstances? So we can run all kinds of scenarios that can help us gain insight in the potential cost effectiveness and the circumstances in which it might be cost effective to use it. And this can help to steer the further development of these tools into the most cost effective solutions that help most people. And also to steer how we should implement it in practice. Should we use it together with other modalities or not? All this information. And during the development of this model, we discovered that the current practice actually is very different from country to country, but also in centers between countries. And therefore, we are developing now also an interactive tool in which people can specifically enter the current practice in a setting, but also how are we going to use AI Mind? And then we can, for a very specific setting, determine what will be the added value of AI Mind if we implement it in this specific hospital or in this specific country, and how should we position it in this country, and what should be all the requirements be for it to become cost effective. So that is what I wanted to share with you, and I'm happy to answer any questions after this session. Yeah.
One ambition in AI Mind was, in fact, to give, after a 5-year project, the audience a realistic picture of what we are doing and if that really has advantages or not. So therefore, the heavy impact on HTA during our development. And HTA is much more than costs, and costs in an economic way, but it's also about the users and the participants. And Eugenio from Roma is also working in our HTA work package and will go in depth of the user perspective.
Morning. Thank you for this opportunity to talk about what we know on patient perception of the artificial intelligence. A quick introduction about me and our group. I'm Eugenio de Brino. I'm a researcher in health economics and HTA in Università Cattolica in Rome. And I'm coordinate a master program on international patient advocacy management for the patient association. I'm here on behalf of the group working on HTA and in Università Cattolica with Rossella di Brino, Teresa Petrangolini, and Deborah Antonini. We have a laboratory dedicated for the patient association. It's called the Patient Advocacy Lab, with the objective is the development of managerial skills of those working in the context of patient organization and citizen in the health sector, to particular attention to the development of a model of competence in this field. We have 3 activity line: research, training, and counseling for the patient association. But why is important the patient perception, and why is important in HTA perspective? In HTA, like just this our colleague before, we have 9 different domain of evaluation. One of these domain regarding the social aspect, so the patient preference, patient perspective, patient experience about the patient association regarding a specific technology. And in my mind, we have the goal to adapt and enrich the HTA approach to the peculiarity of artificial intelligence, identify new potential topic to assessment when evaluating artificial intelligence implication for patient. It's important to remember what we know about the health technology assessment, about the definition. HTA is a multidisciplinary process that uses explicit method to determine the value of health technology at a different point in this life cycle. The purpose is to inform decision making in order to promote an equitable, efficient, and high quality health system.